The Arizona Healthcare Freedom Act is based upon two principles and two principles only. It will, when it passes this November, amend the state constitution and give us two additional protected rights. Number one, if a health care service is legal, no bureaucrat, public or private, should ever be able to tell you you cannot spend your own money to get access to it. Secondly, you should always have the choice and the option to decide whether or not you want to participate in any kind of health care system or plan. In other words, no mandates. Why is this the essence of the entire thing? Because fundamentally what we learned in Washington is that it wasn't a health care bill that was passed. It was a bill that transferred decision-making power from all of you to all of them. And you know what? You need to be in control of your own money, because you don't have to be wealthy to be willing to pay for a second opinion for your child. You don't have to be wealthy to be willing to save up so you can get that extra test so you can sleep well at night. And you do not have to be wealthy to be willing to give up everything to see that the person that you've been married to for the last 40 years has every single thing possible that modern medicine has to offer. And mandates sound good because you're going to get something. But it isn't what you get when you're put in these plans. It's that once you're signed up, you will be subjected to all the rules, regulations, and restrictions that come from being a part of that plan. And for those of you on Medicare, you have to realize there's only about 130,000 pages of regulations. And under the bill that was just passed, it is anticipated that with 118 new bureaucracies that were created in the Senate bill, that within the next 2 to 3 years, there will be at least 15,000 more pages of regulations controlling the kind of access you have to health care. So those are the two basic rights. If it's legal, you should be able to spend your own money to purchase it, and you should not be forced to join something you don't want to. That is it. Nothing else. We worked hard after the Prop 101 near miss to answer the concerns of the people who criticized us. While we would take serious issue with the veracity of their claims, we went and sat down with all the groups. I can tell you with certainty, for example, that the new language of the Arizona Healthcare Freedom Act will have absolutely no impact on the state's access program. We have that. We worked very closely with the same folks, frankly, who worked at Access before 2008 down at the legislature, and there is no issue with that. We have already heard some rumblings that groups like the AARP, I can tell you that even before the ink was dry down at the legislature, they already announced their opposition. I can tell you with almost 100% certainty, they will come out and tell you all that if the Arizona Healthcare Freedom Act passes, it will threaten Medicare. I can tell you with 100% certainty, it absolutely, positively does not. The Arizona Healthcare Freedom Act simply does the two things that I have said. Those of you who were here in 2008, it turns out we really started something big. Losing narrowly with Prop 101 proved the concept that in what was really a very bad year for people who believed in limited government and people who were conservative, with a budget that was worked by the opposition 5-1, with a governor who was on the radio 24 hours a day, 7 days a week, saying how dangerous we were, to lose by 8,000 votes out of 2.1 million that were cast, proved the concept. That's why we went back to the legislature, and that's with the leadership of people like Representative Bartow, with Jonathan Payton down here, and with all the Republicans in the legislature, we got this passed to the ballot. And I can now proudly tell you that 37 states have introduced language mirroring the Arizona Healthcare Freedom Act in their state legislatures, and that would not have been possible without the support of people like you. Virginia was the first state to pass it as a statute, as opposed to what we're doing, which is a constitutional amendment. It has already formed the basis of what was the first filed lawsuit against the Senate bill that was passed. The President signed it at 11:15 or so. I believe the lawsuit was filed 15 minutes later. The state of Idaho has passed the bill. Their new governor signing the Healthcare Freedom Act of Idaho was the first public signing ceremony he did since he was inaugurated. In Utah, it was just signed into law. And we are on the verge in Oklahoma, in Missouri, potentially in Florida, and other states of finding us on the ballot in November to protect these constitutional rights. There's no way, in spite of how simple it seems right now and how obvious it seems to all of us today, that this should win with 80% of the vote in November. It's not going to be that simple. I can assure you that the same forces that spent $150, $200 million trying to pass this monstrosity, which they were successful, will be willing to come after us here in Arizona with the same level of intensity. Because they understand what all of you understand, which is that this is where it began, this is where it's grown from, and they want to kill it here. We cannot let that happen. We cannot let that happen. So between now and November, there's a lot of work to do. We really need the help of every single person here in every way possible. I need you to talk to your neighbors, to your co-workers, the people you may see at church or the synagogue, and explain to them that the Healthcare Freedom Act is simply about protecting their rights to remain in control of their own health and healthcare decisions. We do need healthcare reform, but we cannot have healthcare reform that sacrifices the basic principles upon which this country is founded. I'll finish real quickly and then open up for questions from all of you. You'll see, I think on pretty much every chair, you'll see a brochure for the Healthcare Freedom Act. The website for us is azhealthcarefreedom.com. It's azhealthcarefreedom.com. It's on the brochures. And a lot more there too if you want to bring them for friends and family. And so you can learn more. You can go to the website. It's updated almost every single day with articles from around the country on this. There's, I believe, also some articles talking about the impact this has had in the debate. Because I can tell you, there is no other single outside issue that has much of an impact on the debate as the Healthcare Freedom Act. And again, that's all thanks to you. You can't finish up anything without giving at least a little of a pitch these days. The forces against us, again, are going to be pushing hard as well. They can write big checks. Most of us, including me, can't. So whether it's $5 or $10 or $2, the more people we can get involved, that would be great. That's all here, and you can also do it online at azhealthcarefreedom.com. It's a group effort. We can do this. We will do this, and we can take back this country to say that we believe in healthcare reform, but we will not do it to sacrifice the very rights which we have fought so hard to protect at every generation in this country. Thank you.